Today, we're diving into something almost all of us have dealt with, a tiny but oh so painful problem, the common blister. It's actually your body's own little defense mechanism, but man, it can really ruin your day. So let's get right into how it all works.
You know the feeling, right? You get those awesome new shoes, you can't wait to show them off, and then it starts. That little nagging sting on the back of your heel. Fast forward a few hours, and you've got yourself a painful, fluid-filled bubble. So what is actually going on with your skin when that happens?
So before we even start talking about how to fix them, we really need to know what we're up against. What even is that little bubble that pops up on your skin?
Okay, so a blister is basically your body's own personal built-in bandage. When your skin senses it's being damaged, from rubbing or heat, it creates this little cushion of fluid to shield the super-sensitive new tissue underneath. And that fluid, by the way, it's called serum. It's kind of like blood plasma, but without the stuff that makes blood clot, and it's packed with nutrients to help new skin grow. It's a pretty brilliant defense, even if it hurts.
But here's the thing. As you've probably figured out, not all blisters look or feel the same. And that's because they can be caused by a whole bunch of different things.
Let's run through the most common ones you'll see. First, you've got your classic friction blisters. Yep, those are the ones from our shoes. Then there are burn blisters, which, no surprise, show up after a nasty second-degree burn. And of course, blood blisters. They happen when an injury is bad enough to break some tiny blood vessels under the skin, but not quite bad enough to break the skin itself.
And believe it or not, the list goes on. Blisters can also be a sign of something else entirely, like a viral infection, a bad allergic reaction to poison ivy, or in some really rare situations, even a complication from a broken bone.
But for today, let's zero in on the #1 offender, the good old friction blister. How does something as simple as a little rubbing turn into such a painful problem?
It's really just a simple 3-step process. First, you've got that constant repetitive rubbing. This motion actually causes the top layer of your skin, that's the epidermis, to literally pull away and separate from the layers underneath it. Finally, your body sees the scab and rushes that healing plasma-like fluid in to create a protective cushion. And boom, you've got a blister.
But it's not just the friction. It's more like a perfect storm of conditions that make blisters way more likely to form. Heat is a huge factor. Our skin is just more fragile when it's warm. And the last piece of the puzzle is moisture, usually from sweat. Moisture actually cranks up the friction, which makes all that rubbing even more damaging.
All right, this brings us to the great debate, the big one. You're staring down at that puffy, fluid-filled bubble on your foot and you're thinking one thing and one thing only. Should I pop it?
I mean, the temptation is huge, right? It just feels like popping it and releasing all that pressure would bring instant relief. But is that really the smartest move?
Well, sorry to be the bearer of bad news for all you poppers out there, but the experts have a very clear answer. Nope. The American Academy of Dermatology is super firm on this one. Do not pop it. That top layer of skin, the roof of the blister, is basically a sterile, natural bandage protecting all that raw, healing skin underneath from nasty germs.
And here's why you just shouldn't pop it. The second you break that seal, you're basically rolling out the welcome mat for bacteria. That can lead to a really painful infection, and it's just going to slow the whole healing process down. So what should you do? Just leave it alone. Keep it clean, protect it with a bandage or some padding, and just let it drain on its own schedule. Once it finally drains, you can put a little petroleum jelly and a fresh bandage on it.
So taking care of a blister is one thing, but you know what's even better? Not getting one in the first place. The best treatment is always prevention. So how do we stop these things from ever even forming?
It really boils down to just a few simple things. First off, and this is a big one, make sure your shoes actually fit properly. Then, pick socks made out of materials that pull sweat away from your skin, like acrylic or nylon. If you're using tools or lifting weights, throw on some gloves. And for those spots that you already know are trouble, be proactive. A little foot powder, some moleskin, or even a dab of petroleum jelly can make a world of difference.
And last but not least, a really important warning. If you do get a blister, you absolutely have to keep an eye out for signs of infection. If you see any yellow or green pus, if the redness and swelling start spreading, if the area feels hot to the touch, or if you start running a fever, it is time to see a doctor. An infected blister is no joke. It can lead to much more serious problems, like cellulitis or even sepsis. So there you have it. The science, the right way to treat them, and most importantly, how to prevent them. A blister might seem like a small annoyance, but knowing how to handle it And even better, how to avoid it altogether is going to keep you on your feet and pain-free. So next time you lace up those shoes, you'll know exactly what to do.